Welcome to the Menopause and Cancer podcast, where we speak with cancer patient survivors and incredible experts in their fields to help us find solutions to our symptoms and ideas to improve our health. My name is Danny Binnington, and today we talk about all of your sleep options. Help, I can't sleep is such a common message we get in our community. Your sleep issues might have been kick-started since your cancer treatment. You might be on treatments like aromatase inhibitors, tamoxifen, and you think your sleep has gotten worse since you've been on these treatments. Or maybe you've always been a bad sleeper and now it's just compounded. Maybe anxiety, maybe your night sweats are keeping you up and then you can't fall back asleep. Let's talk about magnesium, melatonin, sleeping pills. Let's talk about cognitive behavior therapy for insomnia. What is the first line treatment for insomnia and what is insomnia in the first place? I'm delighted to be joined by menopause expert, Dr. Zoe Schaedel. Dr. Zoe Schaedel is an accredited menopause specialist here in the UK. She has extensive experience in helping those affected by cancer, and she is also a sleep expert. There is no one better equipped to have this conversation. Please do get your pen and paper out. We've tried to be as quick as possible. This is a super resourceful conversation. And if you have been struggling with sleep, you have to listen to this conversation. I hope it's valuable for you and your sleep issues. Dr. Zoe Schaedel, how are you today?
Yes, I'm well, thank you. I'm good. How are you?
Thank you. And thank you for coming back onto the podcast. You are the UK's leading sleep and menopause expert who has the biggest expertise in helping cancer patients. You run really busy clinics, a private one, an NHS one, and you see complex cases. Do a lot of cancer survivors struggle with sleep, Zoe?
It's a big problem for people that have experienced cancer. And we think about 2 out of 3 of everybody who's experienced cancer will struggle with their sleep. It's really obvious, at the beginning with diagnosis, it's such a shock. It can really disrupt sleep. And there's lots of things to do with cancer treatment, the types of medications you might experience, the type of symptoms you might have, pain, nausea, all those things that really get in the way of sleep. So around that kind of time of treatment, it can be a really big problem. But then what we often see is that it starts and it doesn't go away and it really hangs around. And so somewhere between 40 to 60% of people that have experienced cancer will still have sleep problems a year later, and it can go on for many years after that. And I suppose then we also put in the menopause side of things, and there are similar statistics around menopause. 40 to 60% of women experiencing menopause will experience sleep problems. And so when you put them together, this is a really difficult mix of things going on that can really disrupt sleep. So the majority of people will experience sleep problems at some point.
Wow. So I'm here today with a sleep spray. It's amazing. It smells really lovely.
Yeah.
I just love it when I try and put myself to bed sometimes, and especially when I'm really anxious about not being able to sleep. I've got some really lovely supplements. I've also got my magnesium. I have got so many tools in my toolbox on a quest to help me sleep, but I feel that sometimes they're not doing the trick. And I wonder, can you talk me through, is this all good? Am I meant to have this amazing sleep routine, sleep hygiene? Tell me, is it a sleep hygiene that we're all after?
So sleep hygiene is a term that's used to kind of describe a set of healthy habits. And these are really sensible things and they can help everybody, set yourself up well for sleep. But what they can't do is they can't make you fall asleep and they can't give you a certain quantity of sleep. So it's not that they're bad ideas. They might be really good common sense. But particularly if you're struggling with sleep, so if perhaps you've got something like insomnia, then they're not enough on their own to really fix your sleep. So I think when you ask, is these a good idea? It depends on you and what's going on for you. And if you're someone that would like to just improve your little bit, not your sleep a little bit, it's not too bad, then having some lovely things to make you feel really relaxed and that your bedroom's a really nice place and that, a lovely smelling spray. These are all things that can make you feel really good and create really good kind of attachments with your bedroom and your sleep time. And that sense of winding down can be really, really good for you. So it's not that they're bad ideas, but if you've got a sleep problem, so when I said insomnia, that means difficulty falling asleep or waking up too much in the middle of the night, and it having an impact on your day-to-day functioning, so really impacting on you. And if you have those sorts of symptoms, those problems, then it's unlikely that a lavender spray or the magnesium supplements or any of these little kind of sleep tips and hacks, they may well not be enough to reverse that. That needs a different kind of treatment. So it's not that it's a bad idea, but I think we just have to be realistic about what these things can do and what they're designed to do. They're there to boost your sleep a little bit, to help make it a bit easier, but they're not there to treat a sleep problem if you're experiencing those kind of symptoms.
Who diagnoses a sleep problem, and when do I know I've got difficulty sleeping? Sounds different to I've got insomnia. What is there a difference?
Yeah, and I think it's really interesting because I think we use the word insomnia quite a lot, don't we? We sort of, you can say, oh, I've had a bit of insomnia, we use it, but it's actually a clinical diagnosis. It's a diagnosis that your doctor can make for you. We've got diagnostic criteria, and what they are is if you have had difficulty falling asleep at the beginning of the night or waking up in the middle of the night, and it impacts on your daytime, that's important. So if you've had those things for 3 nights a week or more, for 3 months or more, then you have a diagnosis of insomnia disorder or chronic insomnia. And it's really important to make that diagnosis because, again, like you say, we sort of think, oh, I'm a bad sleeper, but it's really important because there are treatments. When you know you have insomnia, there are things that we can do about it. It's also important to rule out other sleep problems. So what is waking you up? What is it? Do you might have restless legs? And that's more common after cancer treatment as well, particularly if your iron levels are dropping, something really important to ask about, or even sleep apnea where you have difficulty breathing overnight. So you've got to think, well, why are you not sleeping? But if you haven't got restless legs and you haven't got other sleep problems, and it's just that you can't sleep, you're not getting good sleep, then it may well be that we can give a diagnosis of insomnia. And that opens the door to thinking, well, what can we do to treat it? And there are evidence-based treatments. There are things we can do that can really make a difference.
I want to take a moment to introduce something to you that's become a real game changer in my own evening routine. It's a supplement by the Better Menopause. And a little bit later in the conversation, Dr. Zoe Schaedel and I are going to talk about why nutritional supplements alone, there is no evidence that they actually work for our sleep. But we also talk about the anecdotal evidence and how many women say that taking magnesium really helps them fall asleep. And it's also really confusing to think, what supplements do I need? And we don't want cupboards full of supplements, or at least that's what my experience was. I just wanted to keep it simple. And I'm plant-based as well, and so I need to look after my vitamin B levels. We also need to look after our vitamin D levels, and this supplement does it all for me. So it includes magnesium, ashwagandha, saffron. It also includes cherry extract, and it's a really lovely, easy supplement for me in the evening. Now, the Better Menopause is a great company that has supported us here at Menopause and Cancer for a long time. They've supported and sponsored the podcast in the past, and I really love working with them because of their integrity and also their interest in our community. And I'm grateful for them to sponsor the podcast so that I can get it out to you. And so thank you to the Better Menopause. And if you want an easy sort of multivitamin supplement, do look at that one. It is the Better Night Supplement by the Better Menopause. So yesterday, you and I sat on a workshop together in the presence of over 40 amazing breast cancer survivors, and many of them were on treatments like tamoxifen and aromatase inhibitors. And many say to us, these treatments, or since I'm on these treatments, I've got all of these symptoms, and they're putting me into the menopause. And so their general sort of ideas, unless I stop the treatment, my sleep isn't also going to improve. Or we've met with people who are in surgically onset menopause like myself. I can't get my ovaries back. So am I assuming if my sleep is caused because of these invasive cancer treatments or radiotherapy, for example, that my sleep is buggered because of it? I can't do anything about it? Or where does their sort of help come in?
Yeah, so there's a real difference in what starts a sleep problem off and what keeps it going. And I think it's really important to think about this. So something can trigger a sleep problem, and it could be cancer treatment, it could be stress, it could be menopause, and that does for lots and lots of people. But often what keeps the sleep problem going isn't necessarily that thing that triggered it. So we think that insomnia happens to people, that some people are a bit more likely to get it than others, depending on, your personality type and all sorts of your genetics. But then something triggers it. So just say it was surgical menopause and you're experiencing lots and lots of symptoms, like maybe hot flushes, night sweats, you're waking up at night. And that might trigger your sleep problem. So that might be the trigger. But we need to think about what keeps it going. Now, if those symptoms are ongoing, so if you are having night sweats and flushes that are waking you up, or if you're really anxious, or, all of those things that can happen as a result of treatment or surgical menopause, then we should think about trying to resolve some of those symptoms. And that's where medication might come in. So there's lots of different ways of treating sleep. Sleep is a mixture of what happens in your body and what happens in your mind. And often when we treat it, we need to take into account those two things. So Danny, if you said, but I'm waking up 5 or 6, the person I spoke to yesterday woke up 5 to 6 times every night with a sweat. It's really disrupted sleep, and she wasn't feeling, good in the daytime. So let's focus first on trying to treat those symptoms, okay? Now, for someone that can take HRT, that might be helpful. It doesn't work for everybody. But for someone that may not want to take HRT or may not be able to, then we need to think about other treatments. And that's where we need to literally have this whole buffet table of options. So there are non-hormonal treatments. And in fact, that's what the person I spoke to yesterday, I said, well, why don't we just try and cure the night sweats? Let's see if we can improve those. And will that help your sleep? And you see, I'm asking it as a question because sometimes you can cure the night sweats. You can help with some of the anxiety. You can manage the pain. You can treat the nausea. And there'll be lots of people listening to this, but then say, yeah, but I still couldn't sleep. My sleep still didn't improve. And that's because when insomnia takes hold, it's not just about what set it off, those symptoms. It's about what happens in your body and brain after that. And often there's things that the way you think, the behaviours, the actions we do, that somehow makes sleep really hard to come back. You create this habit. It really is like a habit. And so when that's the situation, there are treatments, and these tend to be psychological treatments, talking therapy, that can help to break those habits. It can look at the way you're thinking, the way your emotions play a role, the way what you're doing in terms of the time you get into bed, what you're doing in your bedroom, all those things. If you get into them and try to tweak them, you can make a really big change to this habit that you've built up. So I don't want people to think just because I'm in menopause, just because I'm on a treatment, there isn't anything I can do. There's actually lots.
And I want to talk to you more about exactly what those psychological treatments are. But before we get into that, why is everything so much worse in the middle of the night, Zoe? I know when I've got sleepless nights, I sometimes go around my house and I lie in my children's beds because and I live in a house with a husband and, 3 teenage daughters, and I'm so scared to almost at night feels scary, especially in the times when my anxiety is really bad. I worry about going to bed and then I worry about waking up. So I almost feel like I need to sleep in different places. Like I get in a tiz before I even lie down, before I've even used my lovely sleep spray. Why is everything so much worse in the middle of the night?
Well, I think lots of people will say similar, and lots of people will really find that when they're awake in the middle of the night, their mind sort of races, they're full of thoughts, of anxious thoughts, and this can be a really big part of the problem. Firstly, it's a problem because it's so unpleasant, but secondly, it's a problem because those thoughts themselves actually activate your sympathetic nervous system. So your brain kind of knows that you feel under threat, you feel anxious, and that will mean you set off a series of sort of consequences in your body that then make it even harder to get to sleep. So it's really important to look at those thoughts and why they're happening. And firstly, there is that you're on your own. You're on your own. You're not distracted. It can feel very lonely. You see other people fast asleep all over the world. You imagine everybody else is asleep, and that can feel really awful. But also there is how the brain works is not helping us out in this situation. So there's a kind of part of the brain that generates that kind of anxiety, the emotional center, the amygdala. And we know that's quite active in the middle of the night. And normally in the daytime, we get that kind of balance with our frontal lobe. And that kind of gives us the more logical ability to think through our problems, think through our anxieties. And so in the daytime, you've got this balance. At nighttime, the frontal lobe just seems to be much lazier. It doesn't wake up when we wake up at nighttime. And so we get so much input from the amygdala that we are sort of left in this anxious space with nothing to kind of dampen it down. And it makes it much harder. And we will all have had the experience that at night, you know, really attached to these problems, you feel stuck in problems, that the next day, you think, why was I worrying about that so much? It feels easier now. But the brain does work in a different way. And I think that's why thoughts are really important to look at. So thoughts, the sort of thoughts we have about sleep. It was interesting, you said that, you know, you worry even before you're getting into bed, you're focusing on sleep. We're putting a lot of our mental energy into thinking about, oh God, I really don't want to go to bed. I don't feel good about my bedroom. You know, lots of people start to hate their bed and see it as a horrible place. And all of this thought and all of this focus creates this kind of power around sleep psychologically. And it means we put a lot of effort and attention on sleep. And interestingly, sleep does not respond well to that. The more we try to sleep, the harder it comes. It's not like we know, you know, we need to exercise, we need to eat healthily, and we can try really hard and we can do really well at those things. But if we try and if we focus on sleep, it becomes more elusive. It escapes us. We cannot try really hard and force ourselves to sleep. So some of the treatments that we do is actually about taking the pressure off a little bit and thinking about what's happening with those thoughts at night time. So we talked before about a technique called cognitive behavioural therapy for insomnia, or CBTI. And that's something that a component of that looks at the thinking patterns, and it might ask someone to challenge some of their thoughts. So often we feel like, oh, we're never going to be able to get to sleep, or if I don't sleep tonight, I'm not going to be able to function tomorrow. And you might say, well, you know, would it be helpful for you to think that actually you have been able to function on lots of nights that you haven't slept, and maybe it's not helpful for you to have these sort of thoughts with that power. And there are other ways of looking at thoughts. So there's the kind of challenging it, but also there's a kind of way of just being able to sit with your thoughts a little bit easier and not be so attached to them. So there's some techniques we use like cognitive diffusion, where we just really think, well, I'm having a thought, but it's not attached to me. I'm just noticing that thought. Or, you know, you say that to yourself, I notice that I'm having the thought that I won't be able to function tomorrow. And it can really help just to distance you, to stop those thoughts affecting you so much. And even mindfulness can be useful. In mindfulness, you are observing, you know, in the present moment, trying not to judge the thoughts that you're having, just noticing them. And that can sometimes take the power and the heat out of all these kind of racing thoughts. It is really difficult. It's a really tough thing. And I think often it's about thinking of techniques that you can practice in the daytime when you're not stuck right in the middle of the night. And there's one other thing that I think really helps with those thoughts, which is, we want to maybe try and, you know, notice the thoughts a little bit. It doesn't help to try and push them away. If you try to push away your thoughts, they will sort of always bounce back to you. So we just need to sort of try and develop this acceptance, but then try and get straight back into our body. So being out of your mind and into your body can be a really helpful technique at night. So think about some of those lovely breathing exercises that you can do. So there's the box breathing, there's 4-7-8 breathing, and all of these things make us focus on our body, take us out of our mind, and try to really activate the parasympathetic nervous system, the resting part of our body, and it can really help to take us out of that space as well.
So this CBTI, cognitive behavior therapy for insomnia. It's a program, right? It
That's right.
takes a while. How do I do it, and where do I go for it, and what's the access like? Maybe in the UK, but also maybe, across the world.
Yeah.
How do we do
So,
it?
well, CBTI is a program that you can do. It usually takes between 4 to 6 weeks. So it's not that long, but it can be quite hard. You often are asked to change things, which might feel difficult. And I think it's about making sure you do it at the right time for you. So, depending on where you are with your treatment journey, it might feel too hard. If you are, very recently had cancer treatment or something like that, you want to be in the right kind of space. And you can do it in lots of different ways. So you can do it with a psychologist one-to-one. You can do it in a group. You can do it, actually, they now have digital programs which are really easy to access. You can do it on an app. The one that is free at the moment, called Sleepio. And actually they've done lots of research for using Sleepio in people that have had cancer as well. So we know that it's quite effective to do that. You literally just do it on your phone. And you can even do it, there are books and things. In fact, I came across a really good booklet that was part of a program called Can Sleep, which is in Australia. But it was the booklet takes you through all the steps, but it is designed for people that have had cancer. And maybe I can share that with you afterwards, because actually I really like the way they've just adapted some of the things to really take into consideration what people who've had cancer might be experiencing, some of the fatigue, some of the way that you feel, you might be having a different experience. So there are lots and lots of ways to do it. The digital options actually are quite easy to access. The others are less easy to access. And obviously, it can sometimes make it easier to have somebody there with you, a one-to-one psychologist. That would be the kind of ideal situation for lots of people. And it's very difficult to access that on the NHS. So that's a harder thing.
And what's the success rate? How positive an impact can this have if someone has been diagnosed with insomnia previously?
Yeah. So in the kind of research studies, they certainly see about 60 to 70% success rate with CBTI. And so it doesn't work for everybody. Nothing works for everybody, but it is quite a high success rate. It's recommended as the first line treatment for insomnia in every international guideline. So we've got the European, the American, all of the guidelines say this is the first thing to try because it can be so effective. So that's a pretty good success rate. I think this is, I know I've seen it being successful many times. I also think it's worth, just before you embark on it, thinking, are there any really obvious barriers for me right now that I can do something about before I start it? And I suppose things like, are you having night sweats? Are you waking up with pain? Are you, nauseated? And I think those kind of symptoms, I would love to have an opportunity to try and treat first. So if we can improve those using hormones, using non-hormonal options, that then sets you up to have the best chance with CBTI.
That makes so much sense, because so many people need to get up to go to the toilet because of a weak bladder, for example. And then it's really hard to fall asleep, because once you've been up and then you get back into bed, it's really hard to fall asleep. So it's knowing what to tackle first.
Exactly. Yeah.
So if CBTI is the first line treatment recognized all over the world for insomnia, when does medication come into the picture?
Yeah, really good question. And there's lots of different medications we use. And I think we have to really have an open mind about how we treat insomnia. The most important thing is to treat it however works for an individual. So when would we think about medication? So we normally would try CBTI first. So that's for long-term insomnia. When you've suffered for a really long time, then CBTI is really important, because even if you use medication, if you don't change some of the thinking and the behaviours, often it will come back. So I think it's really important to try that. But in a kind of crisis, so in a short-term insomnia, so for instance, if you just had a difficult diagnosis, or someone close to you is really unwell, or a situation that is clearly shakes you up and means you can't sleep, then there are short-acting sleeping pills that we can use. So they're the kind of, we call them hypnotic medication. They can help you fall asleep. They can make you quite drowsy. And in a short-term crisis situation, we do use those. They aren't something we want to use long-term because they can lead to kind of dependence on them. They can make you very drowsy in the daytime and cause other problems. So we don't tend to find them very effective for people in the long term. But we do have other treatments we can use in the long time. So firstly, all of the things that work for menopause symptoms might help. So those kind of non-hormonal treatments, we've got to tick those boxes. But also there are some sleep, sort of more specific treatments, sleeping pills that we can use. So firstly, there are a group of kind of antidepressant treatment that are quite sedating, but they can help with mood and sleep. And some people find those really helpful. And and they can be used long term. And then there's another newer medication actually that's only been around for coming up to a year now, that's designed specifically for chronic insomnia. And this medication is available in the NHS. And it is designed to treat something we call hyperarousal. So when you said earlier about your mind overnight and that sense of being quite wired, that sort of feeling, you're exhausted, but you're too wired. So the treatment is designed to really bring that down and allow for sleep to happen. And it means that it doesn't cause that same drowsiness as some of those other sleeping pills. And so it can be used in a longer term treatment plan as well. So that treatment would usually be reserved for people that have tried insomnia and tried CBTI and it's failed. So that's where we can normally use that treatment.
And what's that treatment called? Because I'm sure people are going to wonder now.
Sure. So it's called Daridorexant, or the brand name is QVivic. And it is, it's a really interesting option for people. And as I said, I think we just need to keep an open mind and try different things to find the right thing for somebody, because it is important to treat. It can have such an impact on how you feel in the daytime.
And where does melatonin come in? Because I have 5 friends that really swear by melatonin, and I have 5 other friends who say it doesn't do anything for them.
Yeah. In fact, I should have mentioned melatonin absolutely on the list. So melatonin is a hormone we produce ourselves from part of our brain, and it really sets the timing for sleep. So at the beginning of the night, it's saying to you, you're now ready to fall asleep. It sets the clock for us. It's part of our circadian rhythm and our body clock. So it does that naturally. What it doesn't do is it doesn't make you fall asleep. And so when we're taking melatonin as a sort of a supplement or a prescribed medication, then people are often taking it to try and make them sleep. And because it's not really designed for that, it isn't always very effective. However, like you say, Danny, some people do respond really well to it. And actually, if it's prescribed and you use it in low doses, we think it's really quite safe as well. So I very much think it's something that can be tried. In this country, it's a regulated medication, and it's licensed for people that are over 55. So that's because as we age, we produce less melatonin. So the idea is that we use it for that. It can be used for insomnia, although it's not where it's most effective. So it's most effective for things like jet lag and something called a circadian rhythm disorder, where sleep timings get really out of whack. But for some people, they can find it useful. I haven't found it that helpful for lots of people, but sometimes if it works, it's a really good option. It is only licensed to be used for 13 weeks. So that makes it tricky, but if it's working well for somebody and we've tried other things, then it may be something you could use in a little bit of a longer term.
Well, I'm not sure about you and the conversations with your friends, Zoe, but whenever anyone ever goes on holiday now from my groups of friends, everyone always goes, who goes to America and who can bring back some melatonin or some this and that?
Yeah, I totally
so people do all sorts of things when they can't access. Yeah,
I think it's worth saying, without wanting to be a killjoy, it's really tricky. They did a study in 2019 where they looked at all the over-the-counter melatonin supplements, and it was quite shocking that actually almost none of them had what they said they had in them. So the amount of melatonin varied from something like 10% of what they said to 450%. So sometimes you think you're buying a low dose and it's a really high dose, or you think you're buying a high dose and there's nothing in it. But more worrying, sometimes it had other things in it, like serotonin and things like that. So just be a bit cautious when you are buying things. They aren't regulated, and there's good reasons to think we don't always know what we're getting.
Thank you. That is actually really helpful. That's really helpful. In the very beginning of the conversation, we talked a little bit about our sleep hygiene and some sort of strategies, and I want to come back to that a little bit. Talk to me a bit about food, because I'm such a big foodie, and food is really empowering to me. And as much as I know, and I can feel it in my body when I have a coffee, I go ping. As much I also know that coffee sometimes lingers for many, many hours when I think or I feel like it's worn off. But what other foods are helpful or unhelpful? Or is it less about the food rather than when we eat? Because it has an impact on our digestive health and everything. So what's food and sleep? Where are we at?
Yeah, there isn't anything where you can say you're going to eat this and it's going to make your sleep much better. So I think it's about, like you said, timing is important. So certainly eating late seems to be bad for sleep, because we don't want your body to be focusing on digestion. And certainly if you do get any reflux or anything like that, it can disrupt sleep. So trying to separate out your dinner with your bedtime by a good few hours is a really good idea. Eating too late tends to be bad. There are things in certain foods. So there are substances like tryptophan and serotonin that you kind of think, if you could boost those up, because they are precursors to melatonin, actually. So if you could boost those up, would it help with your sleep? And there are some very small studies that have suggested things like eating lots of kiwi fruits, including the skin, eating kiwi fruits before bed could improve sleep. And there's lots of sort of traditional stories that in America after Thanksgiving, people are very sleepy because of the turkey containing lots of tryptophan. So foods that contain tryptophan potentially could boost sleep a little bit. I don't think it's ever going to be enough to help treat a sleep problem. But it's, if you're going to pick foods, then, they are the sorts of foods that might be helpful. I think it's more about a little bit about what to avoid, like you said. And annoyingly, caffeine does hang around in your system. So its half-life can be sort of 6 to 8 hours. So if you have a coffee at 3 o'clock in the afternoon, you'll still have quite a lot circulating when you go to bed. And that really can disrupt sleep. So it is definitely better to try and make caffeine stick to the morning. And the other thing, and in fact, we both spoke to someone yesterday that spoke about this, is alcohol. And people find alcohol really calming. And people find alcohol can help them fall asleep. And we know it can help you fall asleep at the beginning of the night. But it is awful for sleep. It really is. It can, it will often make you fall asleep a bit more easily because it's sedating. But actually, we know that it will disrupt the quality of your sleep very significantly. And, you'll have these little micro wakings through the night that you might not remember, but will make you feel awful the next day. And it can change the amount of rapid eye movement sleep you get, which is just one of the components of sleep. So alcohol really isn't good. And if you are struggling and you can cut that down a bit, it might help you out a little bit as well.
Especially it's so bad for the anxiety the next day. And if you're already anxious, perhaps about not sleeping, and the anxiety just becomes worse because of the alcohol, it's just such a
because of the alcohol
spiral.
And because of not sleeping. And I completely agree. And I know it's hard, and I really get why people get into those habits, but it's trying to find something to replace that with at night. So people are using it because they're anxious, and it's trying to find a way to work around that.
And a little bit like melatonin, I want to ask you about magnesium, because I personally, and I think this is maybe a placebo effect as well, but I love taking magnesium at night, or a magnesium supplement, or a supplement that contains magnesium. But do you have evidence that it improves sleep or not?
Not very much. I used to be really sort of strict and say we just don't think magnesium helps sleep. But I've spoken to lots of women like you, Danny, who do say that it helps their sleep. And actually, there are small studies that do suggest there could be a benefit. So I think I'm a bit more open-minded about it now. We don't, in any of the kind of guidelines, sleep guidelines, no one has put magnesium in. There isn't enough evidence for it to become a kind of standard recommendation. But certainly Some people say it has a calming effect, and actually magnesium is important in sleep. I think the question for me is that most people probably get enough magnesium from their diet, and the studies that are there are for people that are deficient in magnesium, and then when you give it to them, it can help. But I think maybe it's an area that we just don't know enough about yet, and if it helps you, there is no reason not to have it, but perhaps if it doesn't help you, don't feel like it's your fault. It might not.
But that's interesting you talk about deficiency, because most people are probably a little bit deficient in vitamin D, for example, or when we look at the sort of general population. And also I speak to so many people who want to change their diet because of their cancer diagnosis. They might want to move towards more plant-based eating. And then when I really talk to them about what they're eating, I kind of think in the back of my head, I wonder whether this person is getting enough vitamin B12s, for example, which are just in animal products, or then when you supplement. So do you think other deficiencies like vitamin D, vitamin B could have an impact on your sleep as well, or on your overall health? We know, but sleep in particular?
I don't know. There isn't really good evidence on that. And I just want to be really careful, because one of the things that happens when you can't sleep is you literally want to try everything, and you'll go to the supermarket and you'll buy every supplement, and you'll, and there is, and so I always really careful, because actually a lot of these things don't help, and a lot of them increase that kind of focus and effort, and I'm going to try this and I'm going to try this, and you feel like a failure, and so I try to be quite careful, and I don't say go out and buy all these supplements. Let's try and do the things that we really know work, and focus on these things like the CBTI, like those other techniques. But if something helps you, and of course it's important to ensure you're getting a balanced diet with enough nutrients, but you can see what I mean. I don't make lots of recommendations about that, because I don't have the evidence.
Yeah. And thank you for that, because, as well as a patient myself, I had times where I had cupboard fulls of supplements. And when I sometimes re-looked with open eyes, I couldn't even remember why I bought them and what they're for. And so and it is all in this quest to feel better, to do as good as I can. And it's really hard work. So where do we go? We could look at the Sleepio app. We could look at trying to have help with fixing other of our menopausal symptoms before we focus on sleep. When do I know it's the right time? Talk me through that a little bit. Often people come to you, because you've told me that before, when they've not been sleeping for years. We're not talking weeks, we're talking a long time.
Yeah. So I think if you've been struggling with your sleep in the way that we've talked about, and it's been coming on for 2 to 3 months, honestly, that is the time to seek help. So actually, we know that if you struggle with sleep for 3 months or so, it's really hard to get it back, actually. And that's when you need help. It's not impossible, you just need help. And so I think if you've been struggling for months, absolutely seek help. And the other thing it's the time is that you feel like it's having a real impact on your daytime. So there's loads of studies out there showing how much not sleeping will impact on someone at work. People might still go to work but not be their best. How much it impacts on people in relationships, at home, their energy. So when you think it's affecting you like that, then is the time to go and seek help and support. And there is actually more education now for doctors on sleep. It's starting to grow a little bit more. So I really hope that you would see someone that would have good understanding of what the options are, and what you can do to help.
Thank you so much for this conversation, Zoe. I would love to link to the resource, the booklet from Australia, if you want to share that. I'll link to the Sleepio app. I'll link to you guys, because I know you've got stuff on your website that is really helpful for people. Thank you. And I hope people feel positive listening to you, because I think there is so much conversation out there where people really worry about what bad sleep is going to do to them, because we hear all sorts of how bad it is for our overall health, our long-term health, and that can really compound anxiety. And you've just given us this platter of options. This is like a pick a mix of sleep solutions, which I love. Thank you.
Pleasure. Really nice to speak to you, Danny.
I hope this conversation has been super helpful. It's so important to look at the evidence. What is the first line treatment? When is the right time? And what other symptoms might we have to tackle first before we're ready to embark on helping with our sleep issues? Dr. Zoe Schaedel is a true expert, and she has given me a few links for our show notes. So please do have a look in the resources here to find out about the booklet, the Sleepio app, and other suggestions. I feel for myself, I've really taken a very personal approach. I love my bedroom now. I like my sleep spray. I like my magnesium. I know we're lacking in evidence, but I like it. I've also tried a magnesium balm, and I like to take my supplements in the evening. To me, this ritual, although I know from having spoken to Dr. Zoe Schaedel a few times, this ritual isn't really going to cure me of insomnia. Luckily, I'm sleeping really well at the moment, but these rituals are still really helpful for me to set the scene, to wind down, to calm down. I don't have my phone in my bedroom. I try and read a book, and it's really important for me. Sometimes I've got a really lovely sleep mask. I like my lavender spray, and I feel like I'm setting myself up to just calm my body down. I do take some breaths, some deeper breaths sometimes. You know, I'm a yoga teacher as well, and I love really stimulating the calm response in my body. It's really important for me to have that alongside of all of the other strategies that I've implemented over the last few years. And I wonder what it's like for you. Are you really struggling at the moment, or are you also sort of finding your way through? Have you tried CBTI? I'd love to hear from you. You can always pop into our Facebook group and speak to others in a similar situation. And I'm also going to put the link to our Facebook community into the show notes here. Wishing you all the best, and I hope that this information was helpful, and I can't wait to chat to you on the podcast next week.